The cases of human immunodeficiency virus, or HIV, continue to rise in the Philippines. As estimated by the Health Department, cases will go up to over 200,000 by the end of the year. Now, what is causing this prevalence and what can we do to protect ourselves? Joining us via Zoom, live from Pampanga, internal medicine and adult disease specialist, Dr. Edzel Magtoto. It's a beautiful day, Doc Edzel. Good morning and welcome to the show.
Good morning, Miss Anne. It's a beautiful morning to everyone. Thank you for having me. Maraming salamat.
Now, Doc, I've seen this report saying that we've seen a rise in reported HIV cases here in the Philippines this year. Now, what do you think is causing this prevalence of HIV among Filipinos?
Very good question. HIV prevalence in the Philippines is estimated to be roughly around 0.3% of the population aging 15 to 49 years old, specifically the age of 25 to 35 years old, having the high-risk behavior that we so-called. Sadly, we are one of the highest rates of infection increase in the Western Pacific, having at least imagine 58 daily cases of HIV being diagnosed just in the year 2024. So the reasons behind the prevalence in the Philippines are due to a number of factors. We have stigma and discrimination, HIV positive people still having their risky behaviors, 84% of which are men having sex with men, and these are actually very alarming to note.
Now, Doc, let's go back to basics. For our audience who are watching, can you tell us the difference between HIV and AIDS?
All right. HIV and AIDS are two different disease entities. HIV is a virus that actually attacks the immune system, particularly the CD4 count that we call, while AIDS is the most advanced stage of HIV. So HIV destroys the CD4 or the immune system, making the body difficult to fight from infections and illnesses. There's no cure for HIV, but there are effective drug treatments that are readily available now that can help people live a long and healthy life. While on the other hand, AIDS or acquired immunodeficiency syndrome is a condition that occurs when the immune system is severely damaged by HIV. So in layman's term, this is the later stage of HIV already. That is why early diagnosis is very, very important.
Doc, now that we have differentiated HIV and AIDS, meron bang symptoms yung HIV?
Yes, you know what? The thing about HIV, the symptoms about HIV is more easily detected in the first early months after a person is infected by HIV. But many are unaware of their status until the later stages. You know what? The first few weeks, when people is being or when a person is infected by this virus, it just readily seemed like an influenza-like illness or yung flu-like illness na tinatawag. So fever, headache, rash, and sore throat, which are, sometimes akala natin trangkaso lang, no? So when the infection progresses and weakens the immune system, this can cause other signs and symptoms which are like swollen lymph nodes, mga weight loss, afternoon fever, diarrhea, and chronic cough.
So, Doc, you mentioned status earlier and actually just now. Can you walk us through what's the difference actually between a positive and undetectable status?
Okay, so the only way to find out that the person is infected with HIV is through testing, okay? So there is a screening test, but for you to find out that you are actually reactive from it is through a confirmatory test. A positive HIV antibody only means that the body has been exposed to the HIV virus, and then the body has produced an antibodies in response to this exposure. So we have agencies in the country like San Lazaro Hospital, RITM in Alabang that caters confirmatory testing. So once the person gets the confirmatory testing, actually nowadays po, once the person is already reactive, that's the time we start the antiretroviral therapy or what we call as ART. Now, on the other hand, for the undetectable naman, which is actually the main goal of WHO and the Center of Disease or the CDC, we have what we call as the undetectable. So you is equals to you. Always remember that. So undetectable meaning untransmittable. This is when a person with HIV, the viral load is already undetectable in the bloodstream. They're considered untransmittable, meaning they cannot pass on the HIV on to others through sex. And this can only be done through a blood test on what we call as viral load count.
And so for those who want to get tested, are there any free sexual health services in public health centers, or do you have to pay for all the tests?
Okay, actually, I am a part of the City Health Office in the local government unit of the City of San Fernando, Pampanga, and we have free sexual health services at healthcare centers. So we have what we call as the social hygiene clinic, wherein we cater not only entertainment workers, but also walk-in residents in San Fernando and other parts of the country where we cater them and have them tested not only for HIV but also for other STIs, including hepatitis C virus and HPV virus, even for pap smear, no, because this is very, very important. I believe that it's not widely known to other people that we have free healthcare services like this because of service quality, personal factors, and of course lack of knowledge. So I want to use this platform, this channel to tell everyone that your nearby barangay health centers all over the country are catering this health services for you guys to find out and to know your status, which is very, very essential.
You know what, Doc, I think this is very important, spreading awareness that we have actually these free testing centers, right, where people
Yes.
can avail of HIV tests for free. Kasi parang pinaka-problema natin talaga,
Yes.
yung affordable healthcare, right? And I know that the Department of Health has certain campaigns, HIV-related campaigns like the Aura Safely, if I'm not mistaken,
Yes. Yes.
Safer Philippines, right? And for the sake of our viewers, why don't we tell them about these campaigns? What are their objectives, and what are the steps for avoiding HIV?
All right. You know what? We are very fortunate that we're living in a more accepting and inclusive society now. And we have a lot of non government organizations that are rallying for HIV and to end stigma and discrimination. That's why I'm telling everyone that we have a lot of centers, not only from the local government units, not only from the health centers, but also non-government organizations such as Love Yourself. Shout out to Dr. Marvin. I was there in the Love Gala of PT Awards back. And we are promoting and advocating free testing and increasing awareness because HIV is still quite alarming, especially in the country. The steps, very easy. You have to remember A, B, C, D, E. This is what the DOH would want us to remember. So A is abstinence. Kung kayang tigilan, please do so. Importante to know the status of yourself and your partner. Letter B, be faithful, no? Dapat isang partner lang at dapat you and your partner, you both know your status. Letter C, proper use of condoms, no? Condoms should be correct and consistently being used, especially if you do not know your status. So in the local government unit, we give out condoms because that's one of the best ways to protect yourselves against STI, including HIV and AIDS. Letter D, don't use drugs. No sharing of needles to someone you don't know who might be infected with HIV virus. It's a big no-no for us. And letter E, important that we get educated. So this quick conversation we're having is a way of educating people and to get tested early on.
Doc, napaka-controversial nung be faithful.
Be faithful.
Especially
Yeah.
with all the, mga issues of showbiz coming out this year. But Doc, something stuck when you told us about the undetectable status a while ago when we were talking about it. I have a question though. If you are undetectable, can you safely have sex with other people?
If you are undetectable, can you safely have sex with other people? Okay, very, very good but risky question, But the
Okay.
answer to that is HIV cannot be transmitted already if you are undetectable. So if an HIV positive person, or we call them people living with HIV, is undetectable, hindi mo na matatransmit yun. However, the DOH and us practicing physicians, we still highly recommend everyone to use protection such as
Right.
condom because there are still other STIs including hepatitis and sexually transmitted diseases like genital warts and HPVs that are not being covered by the treatment of HIV. And of course, we have what we call as the PrEP and the PEP that are now new to the market, and these are medications being used to prevent HIV for people who are non-HIV positive.
Doc, you mentioned earlier the PrEP and the PEP. I was like, I love them. They sound really
Prep
cool.
and pep, yes.
PEP and PrEP. It's a tongue twister. I believe it stands for pre-exposure prophylaxis,
Prophylaxis,
correct?
yes.
Yes,
Can you
yes.
talk to us more about what that is and how that
Okay,
helps?
yeah, so the PrEP and the PEP can only be availed for free at treatment hub centers or even for other non-government HIV centers. Okay, so the PrEP stands for, as you've mentioned correctly, pre-exposure prophylaxis. So this is being taken by HIV negative but are at risk for getting it, meaning they have high risky behavior. So PrEP can be taken as a pill daily or an injection every 2 months, and it can reduce the risk of HIV infection and stop HIV from spreading if exposure occurs. Now, PEP naman, on the other hand, is post-exposure prophylaxis. So these are being taken by people who have possibly been exposed to someone with HIV, and it's a 28-day course of medication that must be started 72 hours right after the sexual intercourse. Naku, sa mga batang nanonood, hopefully they have parents who are guiding them, right?
Parental guidance yung topic
Yes.
natin. Yeah,
Yes.
rated PG ang topic
Rated
natin this morning. But Doc, are there other treatments and options available for people living with HIV? And my follow-up question to that is, I know that we have these treatments, pero kailangan ba that there are also lifestyle changes to manage HIV?
Okay, what a wonderful question. Nowadays they are people with HIV are very, very lucky enough. Because back in the 1980s, they're taking at least 30 pills a day just for their regimen. But nowadays, it's only one pill a day, a combination of three drugs, or what we call them as antiretroviral therapy or ART. So this medicines, you take them daily, and they reduce the amount of HIV in the body. And the main goal nga is to make the viral load undetectable level. But of course, like any other medications, meron din side effects yan. No? Some of the side effects are like central adiposity, lumalaki ang tiyan at pumapalit ang extremities. Of course, tinatamaan din ng kidneys. That's why some patients suffer from kidney failure and end up going on dialysis. And of course, increase in cholesterol levels or lipid profiles kaya nagkakaroon ng mga heart diseases or heart attacks ang mga patient with HIV because of these medications. So lifestyle, very important. Like us normal people, they need to be very wary and cautious with their life, avoid intake of alcohol, proper sleep, and avoiding stress because sabi nga nila, if you have stress levels, bumababa yung CD4 level nila. And they need the CD4 for them to be normal and to do their daily functions like a normal person also.
So I'm just so curious, Doc, have there been any significant medical developments that we've achieved lately in managing this virus?
Yes, one myth na malayong-malayo na tayo from reality is that HIV before is considered to be a death sentence,
Right.
and that HIV and AIDS are of the same thing. But now we are living in a more advanced world where science and technology set in already, and we have advanced pills already. They just take it one day at a time for them to be at their normal state and do their normal functions. Right now, the FDA in the United States are now working on towards injectable drugs and injectable prophylaxis so that they will only visit their specialists, infectious doctors, or IM like me, at least 3 times a year. Imagine that. So hindi na sila mag-worry masyado sa kanilang mga status. All they need to do is to religiously take their medications, and they're good to go. They're good to function like a normal person.
Doc, before we let you go, I wanted to know, what is your usual advice for someone who's hesitant to take an HIV test? Because, I know that we know that it's a treatable condition now, right? But the stigma is still there, diba? So some people are hesitant to take that HIV test. What is your usual advice?
Okay, one word, love yourself. Always remember to love yourself. So very important to know your status because HIV and AIDS nowadays is very manageable. You can live like a normal person, and based on statistics, kayang umabot 60 to 70 years and more, like just like the life expectancy of a normal person. There are combination therapy that are readily available in the market. They're not hard to take in one day at a time. It's like taking a vitamins. And of course, the stigma and discrimination. That's why we have NGOs right now readily available. We have psychologists who are part of those NGOs para tulungan sila to accept reality that they have been infected with HIV and AIDS. And nowadays, it's the HIV that's stopping people from getting to know their status. But I'm telling you, everyone, it's manageable. All you need to do is to get yourselves tested early on at kayang-kaya nating labanan or sabi nga nila, puksain ang HIV.
Well, dakal salamat, Doc
Yes.
Edzel Magtoto, my kababayan from San Fernando. Thank you so
Thank you
much for
very
shedding
much.
such a positive light on such a
Thank you very
negative
much.
stigma. So at least our viewers will learn more, and at least they're not as scared to tackle HIV and AIDS.
Thank you for having me and Merry Christmas, everyone.
Merry Christmas, Doc!
Thank you. Thank you.
That was such an informative conversation.
Yeah, I know. I learned a lot. Because
Yeah.
normally when you think of HIV and AIDS, it's like an end-all,
Yes.
be-all, right?
Yes,
Like Freddie
yes.
Mercury, like a bunch of famous people. When you have it, you're gonna die.
And the stigma is there.
Yeah.
Like even if we know that it's already treatable, there's medication and everything, people are still scared.
Right, but I
Yeah.
love that Doc said, like, my favorite word, I think, throughout the whole interview was it's manageable.
It is,
Right, people are
yes.
living longer, and he also mentioned, like, especially with the campaign that Pia Wurtzbach does, the love yourself, right?
Yes, yes.
So if you think you have it and you have those symptoms, go get tested, because no one's judging you. We're living in a more acceptable
Yeah.
world. So just do it. You need to live,
And
guys.
the Department of Health, they have
Yeah.
these free testing
Have
centers
all the resources.
that you can check out, right? If that is a problem, if financial problems are stopping you from getting
Right.
tested, then we have these free testing centers, these campaigns. Like I love their Aura Safely campaign.
Right.
Yeah, I love that.